Hello everyone, Vince Cerilli here with the Medicare Coverage Network. I wanted to take a few minutes of your time today to share my personal story. A little bit about my business life, a little bit about my personal life, and hopefully that'll get you the understanding about how that all came together into forming the Medicare Coverage Network and how that can be a valuable resource for you in preparing for your Medicare enrollment. So first of all, let me start with the fact that I'm a senior. I enrolled in Medicare. I enrolled in a Medicare supplemental plan. So I'm a real life example of what steps you're going to have to take in choosing and enrolling in Medicare and preparing for Medicare and enrolling in a Medicare supplemental plan. So there is no hypothetical here. I'm a real life example here. So I can give you my perspective of the decisions I made and what the factors were in my personal decision on making my choices in a Medicare supplemental plan. And secondly, I'm coming from the background of working in the Medicare healthcare field for over 30 years and working specifically with seniors in the Medicare and choosing a Medicare plan over the last 15 years. So bundling those two aspects together should provide you, as I said, a good understanding of what the Medicare Coverage Network is all about and how that can be a valuable resource to you in enrolling in Medicare and preparing for Medicare. So why don't we get started here, and I'll start sharing my story with you. Okay, so let me tell you a little bit about myself and the Medicare Coverage Network. I've got over 30 years of healthcare experience, even though I don't want to admit it. I've been started my career with Blue Cross and Blue Shield of Rhode Island in the healthcare field back in the mid-'80s. Prior to that, I graduated with a finance degree and worked for a couple of different companies managing finance departments, but made the move over to the healthcare world starting working with Blue Cross and Blue Shield, working with the employers in their health plans, their group plans in the community, working directly with them, earned my insurance licensed agency with them. I became a licensed agent with Blue Cross and Blue Shield, worked with them for quite a few years, and then made a move over into independently working for myself. Once I left Blue Cross and Blue Shield, worked in the community, working still within the group environment, working with businesses in the community, providing them with the services they needed, and helping them with their group plans. And many times it also involved not only a group plan, but also some of the other supplemental plans that are out there in the marketplace that I'm sure you've heard of, whether it be an AFLAC plan that helps fill in some of the gaps on some of your health plans, or life insurance through Colonial Life. So I provided and learned much about the healthcare field when I first started out, until I eventually found my way in 2002 to forming my own agency that focused specifically on retiree healthcare and Medicare, and formed a company called Retiree Health Benefits, and in 2002, and began working with actually employer groups, specifically larger employer groups all over the country, that still had an obligation and a responsibility to their retirees once they left employment with them. So what many of these companies did, all these companies did, was provide a group health plan for their retirees. Some of them, till this day, are still financially strong. Companies like American greeting card companies, they have about 3,000 retirees that we help administer their health plan for their retirees. We do various things for them, and administering billing and collection, and working directly and servicing, answering phones for their all the problems and issues that might come up with any of their retirees. Other companies over the years, companies that weren't as lucky financially as American Greeting Card Company, companies like Bethlehem Steel and Enron, that unfortunately went through bankruptcy and eventually never really made it out of bankruptcy. We ended up taking over for the retirees and putting in place plans directly for them. So we continue to this day offering health plans to former employees of Bethlehem Steel and Enron, and service those retirees on daily. So we've helped thousands and thousands. There's many other companies we work with and have worked with over the years, where we've serviced thousands of retirees over the years, and helping them enroll in the proper plan and continually administer the plan for those retirees. So now that same service, which we have plenty, over 15 years experience doing, we're bringing those same services to you and myself, other seniors, and helping you as an individual find the right plan for you, prepare you for Medicare, enrolling in Medicare, and preparing you for a Medicare, enrolling in a Medicare supplemental plan. So that is, in a nutshell, just kind of looking at my work experience in the retiree healthcare field, how it kind of has worked its way into informing Medicare Coverage Network and helping seniors on it, for the last 15 years. And I'll revisit it here in a second, but I'd like to talk a little bit about, which is probably much more interesting, my family. This is my wife, Annette. I've known my wife since the 7th grade. We've been married over 43 years. This on the left is, we do some charity work in the community, and this, I think, was at one of those functions we were talking to the group. On the right, this is a shot in a beautiful place, Scottsdale, Arizona. This is at the base of Camelback Mountain in Scottsdale, Arizona. If you ever have an opportunity to visit Arizona, Scottsdale, Arizona is just a beautiful, beautiful place. Here's our son, Kyle. This is a picture, one of the Christmases, obviously, with the Christmas tree in the background. I can't remember what year this is, but it's going back a few years. And here's some other shots of my son, Kyle, and this is kind of going to tie a few things together for you. This is how I got involved with Medicare. My son, at an early age, 5 or 6 years old, was diagnosed with Duchenne muscular dystrophy. So I had to get, it was kind of a wake-up call. I had to get really quickly into knowing and learning about Medicare, Medicaid, and the services that were in our community that I had to plug into in order to provide those services to my son, whether they be which hospital services, which agencies supported the services we needed from the standpoint of the federal or state agencies, what hospitals we could go to get the services we need, what equipment, wheelchairs, and all different types of equipment that we needed to plug into. So there was quite a learning experience, and I've been learning ever since about Medicare and Medicaid. But that was the catalyst for me to get involved in Medicare, learning about Medicare, which kind of brought my business around from where it was with servicing employers to focusing now on, in 2002, forming retiree health benefits and focusing directly on Medicare and the retiree healthcare business. So this kind of was the catalyst of my involvement with Medicare. He motivates me every day. As I love this picture. Just wanted to share this with you, with the dog on his lap, Oscar, a dog. It's just a great picture. And again, this is why I help seniors and help families. Was again the motivation of Kyle, the catalyst of Kyle, having to plug into those services, having to learn about Medicare, Medicaid, and continuing to learn about Medicaid has been the formation of the Medicare Coverage Network over the years. These pictures here, just to let you know, this is him graduating, 2008. As bad as the debilitating physically of the disease on his body, his brain was just never affected. He graduated cum laude from college and with a couple of different degrees. But unfortunately, as I said, the physical part of the disease just got to him, and unfortunately, April 7th, 2014, Kyle passed away. We lost him. He was 30 years old. But again, he's my motivation, and he's been the catalyst for the formation of the Medicare Coverage Network to this day. So, as I said, we've got lots of resources online. A book here that you can see. There's other videos online that you can take advantage of as a resource. And like I said, to recap, we've got over 15 years experience just helping seniors just like yourself and myself in enrolling in Medicare. And now we've brought that same experience to fruition in forming the Medicare Coverage Network to make that and these resources available to you. Just showing you my license here. I'm active in Rhode Island. That's where my home state is, and we're licensed in many, many states. Just a handful of the states that we're licensed in. We can do. We cross and have reciprocal licenses in many, many, many states across the country to help. And again, we're easy to reach. Online, the MedicareCoverageNetwork.com. You can reach us on this 888-497-6733 number by email. We're very easy to reach, and we really encourage you to take advantage of the resources that are online, as well as taking advantage of giving us a call. We can answer any questions that you would have. And so with that, I think I'll close this out here and just ask, give us a call at any time, and we'll set up an appointment, and we'll help in any way we can, answer any question, and walk you through the enrollment process with the appropriate Medicare supplemental plan that makes sense for you. And we look forward to talking to you.